Travis? Is the mic on? Is the mic on?
Yeah, the mic's hot if the lights are on.
All right. Okay. Well, we're going to go ahead and start. It's 6:30, and since the library closes at 8, we do have a hard stop. I know Cindy will inform us when exactly we need to leave, 7:50, 7:55, something like that. But I want to make sure we get all of this through. My name is Vic Verma. I am with Heart of the Valley Community Connections, HOTV Community Connections. We want to welcome you tonight to this Medicaid Matters forum. I know there's a lot going on in the summer and all the time, so the fact that we have such a great crowd really warms my heart, and there's a lot to talk about. It's a very important issue. Obviously, Medicaid is in the news. There's talk about cuts, the like, but I know people have been calling, organizing, and we're pushing back, and we're fighting the good fight on that, and we're going to continue to fight the good fight on that. There are many people affected by Medicaid, potential Medicaid cuts, or that are on Medicaid, and so it's not hypothetical. So it's important that we stop these cuts. Basically, as far as our speakers tonight, we will start with Tim Faust with Citizen Action. Tim gives a really great presentation explaining what's at stake and what Medicaid is, and it's many things. We will be followed by, we should have, just so you know, we know that Representative Francesca Hong was supposed to be here today. She has some health issues today and could not make it. Chris Alfheim will be speaking in her place when she arrives. We may move things around a little bit depending on when she comes. If she's here by the time Tim is done, she'll speak next. If not, our awesome county executive, Tom Nelson, will speak. And if Chris is here, she'll go first, and then Tom will go. And then we will have Dr. Anna Igler speak. She's a physician here in the Fox Valley in Green Bay. And so she will talk about Medicaid from the physician standpoint. And then finally, we will have the personal stories. I know I've talked to folks, and we will have you come up when the speakers are done. So I will turn it over to Tim.
Great. Hi, y'all. My name is Timothy Faust. I'm from Menasha, Wisconsin originally. I currently live in Milwaukee, so I got to drive on 441 for the first time like in 20-something years. It was very nice. Drove past my grandparents' place in Darboy. Not literally, but I drove past the exit, which I haven't done since I was 15, so that was a lot of fun. Some of you guys recognize me from growing up in Appleton. I'm exactly the same as I was 20 years ago. I talk a little bit slower, but not too much. But I'm currently the healthcare guy at Citizen Action of Wisconsin, which is a community organizing group down in Milwaukee, spread across the state. And for the past 10 years, I've been driving across the country talking to people about their healthcare. Because healthcare needs are very local, right? Healthcare needs in Kaukauna and healthcare needs in Green Bay are different from each other. They're shaped by different forces. And healthcare needs in Green Bay and healthcare needs in Milwaukee are different from each other. And healthcare needs in Bayview, Milwaukee, where I live, and healthcare needs in North Milwaukee are very different from each other. And healthcare needs in Milwaukee and healthcare needs in Memphis are very different from each other. So by getting to talk to people about what healthcare looks like in their part of the woods, I've gotten to learn a lot about what it's like to have a body in America. So I'm looking forward to talking to all of you guys later. If you're here, that's pretty sticky. If you're here, I'm guessing it's because you're concerned about Medicaid. Is that right? Great, you're in the right place. So far, so good. Have any of you ever been on Medicaid? Great, I was on Medicaid. Back in 2009, I was one of the guys that caught swine flu, which I can't recommend. It's a predecessor in the virus chain to coronavirus. It knocks you flat on your ass. Couldn't go to work for 3 weeks. It was the recession. I was working 3 hourly jobs, minimum wage. And when I couldn't go to work, couldn't pay my rent. Defaulted on my credit cards. I went to the doctor's office, got nothing but a $400 bill. Couldn't pay my rent, took out loans from friends and families, defaulted on my credit card, ruined my credit. I couldn't get an apartment under my own name until like 2016 or 2017. And so I learned a really important lesson, which is that when you're sick, don't go to the doctor, because it's expensive. And that's advice I followed pretty religiously until 2012. 2012, I wake up one morning and I've got a really bad cough and I feel pretty bad. And I ignore it because I'm following my own advice. And then the next day I wake up and I feel pretty bad. The next week I wake up and I feel pretty worse. And all of a sudden my roommate Erica is shaking me out of bed because I'm delirious. I have a fever of 103.8 degrees, which is, I mean, you're the doctor, way higher than it's supposed to be. So she rushes me to the ER and they bring me in, they pump me full of fluids, and they bring me in overnight, and the next morning I wake up to a bill for $4,000. And I made like $12,800 that year. This would have completely ruined my life. So I start crying, because what am I gonna do, right? And the receptionist takes pity on me and says, okay, you know, we just expanded Medi-Cal. I was living in California at the time. Why don't you go home and get some forms and come on back and we'll see what we can do. So I did. I went home, got some bank accounts. I didn't have much in there, so it was pretty easy. And brought it back, and she got me enrolled in Medicaid, and my $4,000 bill dropped to $0. Medicaid saved my life. Now, I've got a life right now that I like a lot, right? I live in Milwaukee, I've got a wife, I've got a dog, everybody's healthy, it's fantastic. And I would have none of that if Medicaid weren't there to give me a little bit of help when I needed it. I've got a buddy in New Jersey who's on Medicaid. His name is Steve. Steve has muscular dystrophy. His body is eating itself, basically. When he was born, he was given a life expectancy of 18 years. He's currently 33, so every day with Steve kicks ass. When Steve was born, his mom had to leave her job to take care of Steve. Because Steve needs help washing, Steve needs help eating, Steve needs help going to the bathroom. So all of a sudden, the Way family became a single family income household. And Steve's mom had a job she loved. And of course she gave it up for her son, but she wasn't able to live a life that she really, really used to have and wanted to have again. More importantly, Steve wasn't able to live a full life that he wanted to have. Eventually, Steve qualified for disability care and Medicaid and home health care. And all of a sudden, the state paid a guy named Kyle to come over every day, and Kyle would help Steve with tasks of living, washing, cleaning, eating, and that meant Steve's mom could go back to work. But more importantly, Steve could have the life he wanted. Because Steve is a substitute teacher. Steve is a stand-up comedian. He's pretty funny. He's open for some pretty big names. Steve is an actor. He was in the Hulu show Rami. Have you ever seen that? He's a really entertaining, engaged guy. And because of Medicaid, because of home health, Steve got to have a life that he deserves. That little bit of dignity, that little bit of support to lead a rich, full life. And because of Medicaid making Steve's life better, my life has been made better. But listen, these are scary times. And I'm not going to pretend that they're not. There are a lot of people in this state and a lot of people in this country who don't know if they're going to have health insurance at the end of the year. And I don't want to go back to a world where even more people have to decide between their money and their life. But the only way out is through. I don't think sitting around being scared is very useful. You can't make things better if all you have to go off of are ghost stories. So here's what I'm thinking. I'm going to talk at you for about 20 minutes to kind of lay out the facts and give you some context about what's happening. Later, like Vic said, we'll open the floor. If you have questions, you can ask them then, and if we run out of time, I can hook you up with places to find the information you want and people that can help. That sound good? Great, let's get cracking. Let's take it from the top. Congress is working on a budget that would cut over $1 trillion from government spending. And to do so, they plan on hacking away at a bunch of things. And the biggest target is Medicaid, a program that provides health insurance for low-income people. The House budget that was passed last month rips about $800 billion from the program. And it's estimated that this budget would kick 16 million people off their health insurance, of whom about 10 million would lose Medicaid. In the most recent government estimate, that's about 260,000 people in Wisconsin, 150,000 of whom would lose Medicaid. And these cuts will be used to subsidize a massive tax break, a massive transfer of wealth from working people to the 1%. And that budget is now in the Senate, who should release their own version and vote on it probably tomorrow. But if they cut Medicaid, it's going to affect all of us. And I'm going to explain why. See, health policy is one of those things that seems way more complicated than it is, but it's not. Here's what almost all of health policy comes down to. Healthcare costs a lot of money. Healthcare costs a lot more money than anybody normal can afford to pay for out of pocket, and costs increase a lot every year. However, most folks don't need healthcare at the same time. In a given year, 50% of all healthcare costs come from 5% of the population. In disability activism, there's a phrase, temporarily able-bodied, which I like a lot because it's true. We're all but temporarily able-bodied, we're all but temporarily healthy, because that's a porous 5%. Some years you don't see a doctor at all, and some years you get bit by a dog or learn you have cancer or get hit by a car, and all of a sudden you're smack dab in the middle of an expensive 5%. So we have this thing called insurance. We all put some money into a pot, and when one of us gets sick, money from that big pot is used to pay for their health care. And in America, we largely delegate the function of providing insurance to private companies like United Healthcare or Blue Cross Blue Shield. But the thing is, it's not profitable to sell insurance to sick people because they need a lot of health care. And it's not profitable to sell insurance to poor people who both tend to be sicker and can't afford to put too much money in the pot. So instead of excluding them entirely from healthcare, which is how things used to work, the government developed Medicare, which is a program for senior citizens, and Medicaid, which takes care of people who don't have a lot of money. Any of you on Medicare or work with folks that are on Medicare? Great, amazing. Medicare is a wonderful program. Medicare is funded and run entirely by the federal government. So all the money and all the decisions come out of Washington, D.C. Medicaid is a program that's funded by both the federal and the state government, but is administered in Madison. So because state governments run Medicaid, it can look different from place to place. And here's what Medicaid looks like in Wisconsin. So Medicaid is a big umbrella fund that contains a bunch of health insurance and health finance programs. In Wisconsin, the biggest one is called Badger Care, which is an insurance program for low-income people, children, and people with disabilities. Now, generally speaking, you've got to have a pretty low income to qualify for Medicaid. The actual limits are based on the size of your household and whether you're a parent or a kid, and some arbitrary rules set by whatever state is running it. In Wisconsin, our income requirements are stricter than they are in 40 other states. A family of 2 people who aren't parents is only eligible for Badger Care if they make a total of less than $21,000 a year for the entire household. But there are other Medicaid programs too. Medicaid covers nursing home care and home health care programs for seniors and people with disabilities. That's called Family Care and IRIS. It covers physical therapy, medical devices, and social workers for little kids with developmental disabilities. That's called Birth to 3. It's also the vehicle by which hospitals that treat large numbers of uninsured patients get enough money to stay afloat. Those are called disproportionate share hospital or DSH payments. Medicaid is also the largest funder of mental health programs in the country and one of the largest funders of rehab programs too. 25% of mental health funding and 25% of rehab is paid for by Medicaid. This is all just good financial sense, right? Because money put into Medicaid improves health outcomes, prevents premature deaths, and because folks can get the health care they need when they need it, it reduces the likelihood of catastrophic medical costs. On top of being, I think a moral imperative and a core function of government, through Medicaid we spend money now to avoid spending more money or suffering worse consequences later. And that's borne out in how people feel about it. 75% of Americans like Medicaid. And that includes 2/3 of conservatives. Because we all know that sickness makes you poor and poverty makes you sick, right? They get you going both ways. If things fall in just the wrong way, right? A car accident on the way home, just a bad cough, or just a little run of bad luck, it can ruin your life. And Medicaid's one of the few bulwarks against it. There are millions and millions of people, including me and including all of you, who could need help and be on Medicaid next week and just don't know it yet. So 1.2 million Wisconsinites use Medicaid. The largest group of them are children. About 500,000 children are on Medicaid. Another 400,000 are adults, and another 40,000 are either foster kids up to age 26 or are currently pregnant. And there are some stats you might have heard in the past couple of months. In Wisconsin, 1/5 of the total population uses Medicaid. And that includes 1 in 3 children, over half of nursing home residents, 1 in 3 people with disabilities, and 1 in 6 people on Medicare. Wisconsin spent $11 billion on Medicaid last year, and 60% of that, $6.6 billion, came from federal funding. That's the money Congress is trying to cut. But you got to keep in mind that $11 billion isn't just thrown into the lake and set on fire. It's turned into salaries, it's turned into county health programs. It is a massive driver of state and local economies. So when you cut that $6.6 billion, what happens? What are the consequences of cutting Medicaid? Well, first and foremost, people will lose their health insurance. That means they'll either rack up medical debt and go bankrupt, or avoid getting health care they need, causing worse and more expensive problems down the road. Problems we ultimately all pay for in lost work, packed emergency rooms, and government-subsidized unpaid hospital care. Second, facilities that treat lots of Medicaid patients will close. That means rural hospitals and clinics in poor neighborhoods where you have higher frequencies of Medicaid patients. In states with more restrictive Medicaid programs like Wisconsin, rural hospitals close 4 times more often than they do in states with more generous Medicaid programs. And this is silly. This is barbarism. This is the unmaking of American healthcare. They're making us all suffer so they can punish people who already have a tough time getting by. Now, Republicans like to claim that they're targeting fraud, waste, and abuse, which is a sort of catchphrase they use to encourage you not to think too hard about what they're doing. Fraud is a shorthand for anybody they don't like using the program. Now, the cornerstone of the budget that the House passed was implementing work requirements in Medicaid to root out the lazy or undeserving poor, as Ron Johnson said, the grifters. But it turns out virtually everybody who's on Medicaid who can work is working, whether at a job or as a caregiver or is in school. States have tried work requirements before, in Arkansas and in Georgia. And the process of enforcing work requirements, of building that infrastructure, of checking the paperwork, costs a lot more money than work requirements save in cut benefits. And a lot of those cut benefits are from working people who can't keep up with the nonstop paperwork. I used to help enroll seniors in Medicaid. And I'm very good at using the computer because I'm a millennial, that's my whole deal. But even with my assistance and the phone numbers that I had, it could take 2 to 4 weeks to enroll a senior citizen in Medicaid. So having to go through that process month after month, of course people are going to churn out. They can't keep up with the constant paperwork. And on top of that, Republicans are calling for all people to go through additional toe-to-tip re-enrollment processes twice a year. They are drowning Medicaid recipients in an ocean of red tape. And we've seen it happen before. People are losing their insurance for bullshit administrative reasons or paperwork reasons in the name of fraud and abuse that simply does not exist. Now, the thing is, Medicaid's one of the most effective healthcare programs out there in terms of dollars spent to healthcare covered. When fraud is discovered, it's always private companies committing it. Like when a rehab facility charges for a patient they didn't care for, or when a private company administering Medicaid requests money they don't use on healthcare. And we've got mechanisms for finding and preventing this kind of fraud. If you want to cut fraud, you got to invest in the infrastructure which prevents it. But a blanket Medicaid cut doesn't do any of that. If Congress cuts national Medicaid funding by $80 billion a year, just an across-the-board cut, Wisconsin would need to spend an extra $500 million just to keep things where they are now. Or we got to kick folks off Medicaid or pay physicians and hospitals less. That's the breaks. There is no other option. No matter what policy language or accounting techniques you use, any cut to Medicaid is going to kick people off the program, and this is the choice Congress wants to force Wisconsin to make. Increase taxes, spend money we don't have, or take away people's insurance. See, Medicaid is one of the most visible, touchable, real-world ways the government shapes your life. It's infrastructure. We think about infrastructure as things like bridges and highways and sewers and things like that, and that's true, but healthcare programs like Medicaid are the social infrastructure of America. Whenever a construction worker gets a cortisone shot, and a busted shoulder that lets him keep working? That's Medicaid. Whenever a single mother who takes care of her dad full-time gets an inhaler in the mail to take care of her kid's asthma, that's Medicaid. Whenever a guy in a wheelchair can live at home with his girlfriend in their apartment instead of being warehoused in a nursing home, that's Medicaid. So an attack on Medicaid is an attack on society, the whole arrangement of people and resources that make our lives worth living. Why would you attack society? Well, the people who want to hack away at Medicaid are doing it so they can give that money to the billionaires who fund their campaigns. It's so simple. It's so stupid. It's always the case. This is what it's always come down to. People who control over $100 trillion, which is 300 times what it costs to go to the moon, want another 4 trillion more. And Congress has decided that you and you and you and me are going to pay for it. You know, I grew up Catholic at St. Patrick's Parish in Neenah. And like many people who grew up Catholic, I'm no longer Catholic. But every world religion I know explicitly condemns any person who prioritizes their own wealth over the well-being of others, right? If you're a Bible head, think of Luke 12:14. Life does not consist in an abundance of possessions. Or from Judaism, the Tanakh. The wicked in his pride persecutes the poor, let them be taken in the devices they have imagined. Or Atakathur from the Quran, you are obsessed by greed for more and more, and you will be called to account for what you did with the gift of life. And yet these people, who can't look God in the eyes, are the very same people whom our elected officials have decided matter more than you or me, and they must be stopped. We cannot let them dismantle the society we have built for ourselves. Let's make something clear. We're here to defend Medicaid, but that's not the real battle. Medicaid is just, Medicaid is essential, but for all the good it does, Medicaid remains in many ways an inadequate program. Not enough people have it, not enough providers take it, and for many facilities that depend overwhelmingly on Medicaid, it doesn't pay enough. So our goal, if you're with me, is not just to defend Medicaid. We are not made healthier if all we do is prevent catastrophe. Our goal is health justice, which begins when all people can get the health care they need when they need it. Now, here's the trick about organizing for health care in America. It is the easiest thing in the world to talk to people about. Every single person in America has been screwed over or knows someone who's been screwed over by the healthcare system, right? You know, I've talked to thousands of people in big cities and small towns, black, white, and brown, sick and healthy, who know they're being screwed over and pushed around, even if they don't know how or why, and who hope for a vision of a gentler and more beautiful world for themselves and for their families, and sometimes even for people they don't know. But let's be realistic. Ron Johnson isn't going to have a change of heart over this budget. And so our job is to develop movements that demand something different. And so if you, like me, want to fight back, our goal is to find and touch the people who have not been touched, to ask questions and to listen, and to show them the parts of ourselves that they might recognize in their own lives. And this kind of slow and difficult work, the work of persuasion and organization, is the only thing that works. The only way we can fight back began nearly a century ago when huge swaths of the country banded together for decades and decades and decades to demand that America provide health insurance for people private companies can't make money off of. This is hardly a radical belief. We're discussing a simple principle of fairness, that someone with $5 and someone with $5 billion are equally worthy of the freedom to live safely in their own bodies. You know, I think about what happened in Idaho back in 2018. Idaho, barely a bastion of progressivism. 3 friends bought a Winnebago and painted it green and drove across the state for over a year to build a movement to expand Medicaid at a state referendum at the ballot box. And that movement won 61% of the vote, even as the Democratic nominee for governor lost by 22 points. See, mass movements talking to people who aren't like you, reaching out, are the only thing that wins power. Right? We just saw what happened in New York 2 days ago. 50,000 volunteers hit 1.2 million doors and defeated tens of millions of billionaire dollars. And that kind of success doesn't happen through luck or chance. And so I promise you that through the solidarity, and only through this solidarity, a better world is possible. So when we leave here this evening, I hope to leave shoulder to shoulder with you all. Thank you very much.
Thank you so much, Tim. Our next speaker is our state senator, Chris Alfheim. Chris has been, had a busy schedule today, and we're very glad that she's here to be able to speak. So thank you, Chris.
How are you? So I was going to do my best to attend today, and then about 2 hours ago, as I found out that Rep. Hong was not going to make it. So I'm literally just stepping in to say we are paying attention to all of this. Everybody has done such a great job of showing up to listening sessions, sending us messages, making phone calls here in the state. Obviously, we got a little something going on called a budget right now. I've been on caucus for multiple hours, and the best I can tell you right now, it is far better than you think it is. There are very positive vibes coming out right now, so fingers crossed on that. What I'll say in Medicaid is that the Democrats in Madison understand that the most important thing we do is take care of one another. Medicaid and the fear of systems and programs being taken from you means that we have to be prepared to then step up and make sure that everybody that needs our assistance gets that assistance. We don't have a perfect plan for that. In fact, I would challenge we don't have much of a plan at all. We are hoping that our courts and our guardrails that we have at a federal level do their job and protect our good people that are just trying to get by right now and utilize the systems that they've been promised all of these years. If they don't, we will be there. Okay, we will be there. I would love to be able to give you a 20-minute PowerPoint, but I was not prepared to do that today. If there are any quick questions, I will try and answer them. Otherwise, I'm going to make way for Tom here. He does a great job.
What's the best way we can help you besides contacting your office?
You can keep on sending us messages. You know it's well received, but pound on the Republican side. That's the real answer, because we get it. You know that we are understanding the issue very clearly, and we are compassionate and empathetic towards it. It's the rest of the population down there that needs to hear it, both in DC and in Madison. The changes that are going on the federal level right now in the Senate have to do with the fact that they have figured out that the red districts are tremendously affected as well. So as soon as they figure out that it's their people that they are considering hurting, they start to pay attention. And that's what we need. Bottom line is, Republicans have majority. That means they have power. We have to ask them to be better. So you making those phone calls, you sending letters on and on and on. You know Ron Johnson doesn't answer his phone. We've all tried that before. But pound them with mail. Pound them, not just with email, hard mail, postcards, everything you have, keep it in front. Letters to the editor, opinions, talk to your neighbors, do everything in your power to be out loud. You're not speaking as a Democrat. You are speaking as a human, as a citizen of this country, and as a constituent of all of those people. You have every right, and I would say right now it is our obligation to be as loud as we can. Good question.
So plan for keeping we have, where do you stand on Badger Care expansion?
We all love Badger Care expansion. I can tell you we spend hours talking about it. Are we in charge of getting it? No, we can't, right? That is the reality. We will not have control of that until we have the majority. We have a little bit more power this year, which is awesome, and it will come to fruition. Bottom line is the Senate needs votes from our caucus to do it, and we are standing strong together to get everything we can. But Badger Care expansion, a true expansion, can't happen until we actually have the majority. So we're in countdown phase on that. You know what we need you to do to make sure that happens. Good?
Beyond the sharing our own voices or personal concerns, are there any hard questions that you would recommend we ask of Republican representatives or senators? Any things where maybe you think they're close on? or ways to kind of corner them a little bit? Like, are they planning anything in the budget? Like if the federal budget falls
No.
through with funding? No?
The answer is no.
Okay.
One, it's hard to do. You can't. So
Right.
their answer is there is no plan B in the state other than there are dollars there, but it's going to be entertaining and it's not a good situation. Let's put it that way, right? We don't want that to happen, and I think everybody down there knows that. So in the budget right now, there is not a plan for let's save all these dollars in case this happens. That does not exist.
Okay.
Good? Yes, sir.
So we hear a lot about how, we need cuts and how we can't, there's just not enough money to pay for these good programs. Could you enlighten us currently, right now, what is the surplus in the state budget?
So the surplus is sitting at 4.6, and we acknowledge that.
4.6 what?
4.6 billion, right? That's a big, beautiful number. Talk about big, beautiful, right? And there are plenty of ways. There are plenty of ways that we could be or should be utilizing those dollars, and we believe that. We also do have the issue. Our cost to continue Medicaid in the state of Wisconsin, so never mind any cuts, if everything just stayed the same, cost to continue the programs that we have is an increase of $1 billion in this budget. So yes, the surplus is there. Yes, we ought to be taking care of our municipalities and our schools. Yes to all of that stuff. But I think the 4.6 billion, which continues to come down little by little, Medicaid, we have an aging population. We know this to be true. So there are forecasted numbers. If you've got a $1 billion cost to continue in this budget, what's it going to be in the next? Will it be less? And that's assuming zero cuts on a federal level. So I think there is a little bit of trepidation in saying, let's just spend that stuff. I don't think we can do that. I think we have to be civilized in that conversation where we've been underfunding things for years. And if we're going to correct those problems, we're immediately taking that future number down. And if we have that cost to continue problem going up, which we do, again, this is our obligation, then we have to be prepared on that as well. None of us want to be in a situation of having to raise taxes, but we all have to be committed to taking care of the people of Wisconsin. That's the bottom line. Yes, ma'am.
So then we should not be even talking about sending part of that surplus back to taxpayers.
I'm a big fan in making our communities and our families whole, which means educate our kids and take care of our counties and our municipalities that have been underfunded so bad that our property taxes are sky high. I'm a big fan of correcting the bad math that has gone on for over a decade. I think that there can be some reasonable gives, but should it be the priority? No. The priority should be getting Wisconsin back in line with understanding we have obligations. And we must first take care, we have always been taught work before play, right? Obligations to one another in this state, that is work we have to take care of first before we start playing and passing it off backwards. Last one, Rana.
Who are the Republicans that we should be putting the heat on that are most vulnerable or are most apt to join with us?
If you live in Neenah, Menasha, I'd be reaching out to Rep. Coffert all day long. He is a fairly reasonable guy. He is in a very vulnerable position, and he claims to be a moderate, has been a moderate in the past. I would love for him to show that, prove it, and I think that's a fair request. Saying you're a moderate, saying you're this doesn't matter. Can you put it to the floor and vote on it? Because if you can't back it up in actual votes, then you aren't actually a moderate, are you? And I like the guy, but that's what it comes down to. He's a nice guy. Anybody else for me? Otherwise,
There was talk about tax rebate for people over 65 not paying taxes. Where is that standing right now with the?
I'm not sure I can tell you.
Okay.
I don't, again, these are closed caucuses, so I'm new at this, so I don't want to screw it up on my first day. But I'm going to say that the Republicans are not getting everything they want, but there is some good coming to a lot of families that I think is valid. Did I do that without getting in trouble? All right. Thank you for giving me 2 minutes. I appreciate you all being here. Keep up the fight.
Chris on short notice, because I know you're running off to another
I got a union to help.
union to help. Yes, so thank you so much, Chris. We appreciate it on short notice. And our next speaker is our county executive here in Outagamie County, Tom Nelson. Tom can share the local perspective, and also he was in the legislature himself.
I was.
In this district. So
Long time ago.
Long time ago. So
Long time ago. All right. All right, good to see everyone. Great turnout, of course, as always, here in Outagamie County in Kaukauna. You know, before I begin, Tim was talking about how the system we have here is completely messed up, and it can be a complete con. It usually is. Before I think maybe like 2 hours ago or so, I actually had a call from a constituent or an email from someone here in Kaukauna. And they went to the hospital, they went to urgent care, but they were billed as if they went to the emergency room, which is a really, really big difference in price. So this constituent called and they said, no, the billing is right and you are wrong, over and over. So I had my health and human services director call and make sure, and in fact, the constituent was right and the billing department was wrong. So we're going to fix that. And for every contact I get, there are not hundreds, but there are thousands of people and cases that are going through a similar situation. So my opinion is the best solution to all this would be a single payer system, Medicare for all. But so we got this to work with. And as county executive, I have 29 departments, everything from a sheriff's department to highways, solid waste, recycling, an airport, the international airport does very well, by the way. I also deal with Health Human Services, and the Health Human Services Department is far and away the largest department we have. And we have in one of the slides that Tim put up, there were a number of programs below Badger Care. And so most of the programs underneath Badger Care are the programs that we work with. So pretty much everything under Badger Care. So you can see that program for program, that's most of what we're talking about. And in our county, if anyone can guess, just Medicaid-related county cases, because anyone guess how many individuals rely on Medicaid at a county level here in Outagamie County?
What's the population of the?
180,000.
No, the population of the county?
180,000.
180. That's 1 in 5, right? Give or take.
Okay, so we have about 30,000. I beat you, Anna. So about 30,000, and that's just Medicaid. But the Health and Human Services Department in general, at any given time, we have about 35 to 40,000 open cases. That's everything. That goes beyond Medicaid. Now, just Medicaid coming from the federal government to the state to the county, and Tim explained this very well, we rely on about $11,950,000. Put that into perspective, the tax levy is about $65 million. So if we were to lose almost $12 million, you're talking the equivalent of about 20% of the entire county tax levy. That's a big number. It's significant as far as operations in the county goes. The law will remain the law, and so that there will be people that will need our services. You know, we're not the first line of defense. We're the ones who come in and make sure that however many openings and however frayed the safety net is, that we catch as many people as possible. That is going to cost money no matter what Congress does and what the president does. So as the backstop, we have 20,000 people, and that's a big number, but it's just one county out of 72. And so my responsibility as a county executive is working with the state people like Senator Alfheim, which, by the way, Senator Alfheim is doing a great job. She's my state senator, she's great. And the leadership we have down in Madison now is just so tremendous, the best we've had in 15 years. And we might not get everything, we won't get everything we want this time around, but the progress we're making that she speaks to is absolutely significant. So as county executive, I play the role of taking the resources that come from the state level that come to the community. Most of the programming is actually not done through Madison.
The state government is the one that allocates the money for these programs at the local level. So depending on what kind of county board you have, county executive, what kind of workforce you have, a community that supports the things that we are doing makes all the difference in the world. A lot of people will focus, and rightfully so, what's happening in Washington because that's where it begins. That is where the source of these policies come from. But for communities not like Outagamie County that do not have the infrastructure, that do not have the type of relationships we have between the nonprofit sector, local government, private sector, you don't have the basic social infrastructure to be able to come together as a community to make those programs work. We have a tremendous, we have an incredible workforce in 12 different divisions that provide these resources. And when I was going around a couple of years ago doing town hall meetings with our departments, I met with each of the different divisions in Health and Human Services. And so I met with, I think the Public Health Department. And so to put this in a context, when I met with them, it may have been like one half of this room. And then we went to the next. And when we went to the mental health, AODA, which is the lion's share of this programming, the entire room was filled. We have over 60 caseworkers just dealing with those issues. And most of their salaries are paid for by Medicaid. If the Medicaid funding goes away and we can't backfill it with levy, with the local tax levy, because of course there are restrictions on what we can do, how much we can raise and how much we can spend, what's going to happen? So this is the point at which we work with the people of the county to make this happen. And I'm very fortunate to have such committed public servants, and even though there's all this chaos going on, and I know, and I'm so grateful for the work that you do here on the front lines calling attention to this, because county board supervisors, county workers, we need advocates. We need people that recognize what we are doing. A lot of what we do in the county is very visible. The roads that you drive on, the bridges you drive over. You see a lot of it going on Highway 41 right now. You see some squad cars, Outagamie County Sheriff. Hopefully you don't have too much involvement with those guys. But when it comes to health and human services, the difference we make is real, but you don't see it. You don't always see it. And at any given time, you have 35,000 residents, 35,000 open cases working on these, everything from public health to mental health to child protective services. It is absolutely critical that we keep this funding. And I know that there are legislators that will not listen to you. They might not take your phone calls. You might not get them to yes. But you know what? It is their job to take your call. And it is your responsibility to make sure that those come in, those emails come in contacts. So do not take your foot off the gas, especially right now, because once the budget passes, there will be more business in the legislature, but this is where the action is. This is the time to double down and to keep calling. Even if you have a Republican representative who never returns your call, keep calling, show up at their office, keep emailing. I'll tell you what, being a former legislator and being a former legislative leader, the absolute worst thing for someone like Robin Voss or whoever the state Senate majority leader is, the worst thing to have is for a freshman legislator or someone from a tough district or maybe someone with very thin skin, which most of them have very thin skin, trust me, I know this, to keep getting calls from constituents. They're not going to go back to the constituent. They're going to call on the Speaker of the Assembly. They're going to call on the state Senate majority leader. And that type of pressure makes a big difference because it goes beyond that district and it goes into the leader's office and it makes things very difficult for them to do their jobs. So even if you are in a district where you have a representative who does not vote the right way, that does not see this, that does not see the issues the way that you and I do, don't stop calling that person. It's your responsibility. Thank you.
Our next speaker is Dr. Anna Igler from Green Bay, when we're talking about healthcare, okay, when we talk about healthcare, you have to talk about physicians and healthcare. So I'll turn it over to you.
Yeah, thanks. Thank you. So my name's Anna. I'm an OBGYN, and I've been practicing in the Northeast Wisconsin area for over 10 years. I currently work as an OBGYN hospitalist at Theta Care in Neenah, and prior to that, I worked in a private practice both at Bellin and then at Advocate Aurora in Green Bay. So I've worked in mainly the office in the hospital, and now I work like purely in the hospital. So I really see firsthand how important Wisconsin's Medicaid program is, which is Badger Care for my patients. And the cuts proposed by Trump's administration's federal budget proposal, the One Big Beautiful Bill Act, would directly affect the pregnant patients that I care for. And as of November, this was in 2024, over 70 million Americans were enrolled in Medicaid. And in Wisconsin, about 2 out of 5 pregnancies, so up to 40% of pregnancies are covered by Medicaid. That's a huge number. That's almost half. And, just a quick review, I know we talked about this, but Medicaid is the government health insurance program, and it's both funded by the state and the federal government. And it offers free or low-cost health care to adults and families with limited income, people with disabilities, pregnant people, and people in long-term care facilities. So approximately 1 in 5 people across the U.S. have Medicaid coverage, and that's 40% of children nationwide and 80% of children living in poverty. As you said earlier, the proposed goal is to cut about $600 to $800 billion over the next 10 years. And these cuts would require Wisconsin to put up much more money to the program. And if Wisconsin is not able to pay the difference, Medicaid services and eligibility would be reduced. This would cause serious problems across our healthcare system. This would affect hospitals, offices, and healthcare workers. And it would cause a devastating ripple effect for the health and welfare in our communities, targeting our most vulnerable populations. So a good example, which is already happening across our state, is many rural labor and delivery units have been closing across the state of Wisconsin. I know of at least 3 small units that have closed within the last year across the state. One is a smaller unit that's part of the Theta Care, and then 2 with the Spirus have both closed. And that's a really big deal because there are a lot of maternal health care deserts in the state of Wisconsin, and people with limited resources in those rural communities, when they're pregnant, now they have to travel even farther for prenatal care and delivery. And that costs gas, that costs more money for them. And if they have to see a specialist, they have to travel even farther. This might, she wants that. So this might seem like a no-brainer, but obviously some in Congress do not understand that just because people don't have health insurance doesn't mean they don't need medical care. And Senator Mitch McConnell, he didn't pay attention in health class because pregnancy ends, right? Pregnancy ends. And most people, this is a great example, most people deliver their babies in a hospital. So they need to be delivered. And their babies need to be cared for, whether they're insured or not. And when 40% of the pregnant women in our state are covered by Medicaid, if 10% of those lost coverage, that's a lot of money. An uninsured delivery stay will cost over $20,000 for the mom. And I know this because I just had a baby. And I remember my first child, my son, was born in 2018, and for some reason there was a mix-up, and I don't know, it was a couple weeks postpartum, and I was really sleep deprived, and I opened a bill for my my hospital stay, and the amount owed on there was literally like $21,000, and it said insurance coverage $0. Okay, I almost fell off my stool, and I started crying because I was shocked. I was like, I thought my insurance was supposed to cover this, and it turns out that they made a mistake and they didn't even bill my insurance. And it was funny because I was insured by my employer, right? And I'm an OBGYN. And I called the billing department and I said, hey, I think there's been a mistake. And she said, oh, no, there isn't. You don't have insurance. And I was like, yeah, I do. Like, I'm employed here. Anyways, so it worked out fine. But, I mean, no one can afford that. Majority of people cannot afford that. And that's just the hospital bill. If the baby needs NICU care, think about that. Think about a premature baby born at 25 weeks, okay? Multiply $20,000 by 10 to 100, okay? Some of those babies are there for months. And it might be really hard for us to get over that one, right? Anyway, so last time I checked, I thought the Trump administration wanted to save babies. What about you guys? They were all into saving babies. And now they want to take away their health insurance and health insurance for children. Well, wait a second. There's supposed to be a baby bonus in the budget, right? $1,000? I guess they're supposed to use that money to help cover their prenatal care and their delivery. So people clearly can't afford uninsured prenatal care or delivery costs. So then if much of this is then left unpaid, right, people go into debt, the money has to come from somewhere else to cover uninsured patients at offices and hospitals, because the hospital systems, they can't run if they're not paid for, oh, I know, honey, most of their services. Because, you know, if somebody comes in labor, whether they're insured or not, we have to admit them and deliver them. We can't turn people away. So the cost just gets passed on to other areas and to other insured patients in the system. So if you have private insurance, you will also still be affected by Medicaid cuts. And I think that's something that a lot of people don't necessarily understand. So in the system that they would like to operate in to cut Medicaid, really nobody wins. I guess except for the top 1% that's getting the big tax cut. Medicaid covers a lot of preventative care, right? Which helps prevent serious disease, and it makes our communities a healthier place, right? Maha, right? Aren't we supposed to be Mahaing now, right? So for example, in my field, inadequate or lack of prenatal care increases risks to both the mom and the baby, okay? So lack of care increases the risk of preterm delivery, right? Which then results in a premature birth. Those babies will be in the NICU. That costs more money, right? Because the NICU is very expensive. It's an ICU for tiny little babies, right? It increases the risk of low birth weight babies, stillbirth, infant death within the first year of life, and long-term health problems in children, like learning disabilities and developmental delay, which all ends up costing money. And for maternal health, the lack of prenatal care, it increases the risk of maternal death. Risks from pregnancy complications like preeclampsia increase. It increases C-section rates and delivery complications, which all increase the cost of medical care. okay? And it's just not good for people. It just doesn't make any sense. If these things are preventable, why wouldn't we prevent them? So treating the complications related to no prenatal care is much more expensive than covering this preventive care, right? I recently, just a month or two ago, I cared for a patient that came in with no prenatal care. And, you know, she suffered severe complications. She almost bled to death. She almost died during her delivery, and she needed a hysterectomy. And this, honestly, for her, it would all have been preventable if she would have just had prenatal care. The U.S. already...
Let her present.
I know, she's so good. She's so good. And the U.S., as many of you may know, already far outstrips the maternal mortality rates compared to other major industrialized countries. And if we cut Medicaid, that will make it worse. And the abortion bans are already making it worse, okay? So from the WHO in 2020, the US averaged about 22 deaths per 100,000. And at the same time, compared to Canada, they had 8 per 100,000, and the Netherlands had 3 per 100,000. It's clear that federal cuts to Medicaid will hurt many, and it'll disproportionately affect the most vulnerable in our communities. It will have far-reaching consequences. And Trump ran on a campaign promise not to cut Medicaid. Not that I would ever trust him. I'm sorry. But let's hold him to it. And I would urge you to, again, contact your senator and representative and tell them that we do not want Medicaid cuts, no, in order to fund more tax cuts for the wealthiest Americans. I'm going to remember who voted to cut medical care for pregnant women and children in this next election in the midterms. If it goes through, I'm going to remember who voted for it. And I hope you guys will too. Thanks.
Thank you, Anna. Great job, great job. And great job, Lena, as well.
Yeah, I feel the same way about Medicaid.
So we're now into our the final section of our program.
Medicaid and how it affects people in our community. I appreciate you taking the time to be here and to listen. My name is Carrie Forster, and I am a lifelong Kaukauna resident and the mother of an adult son with autism. My son Alex recently turned 35 years old, and I would like to share his Medicaid story. Alex has non-speaking autism, which under current guidelines would be classified as autism level 3, the type of autism that requires the greatest level of supports. Alex is someone who will need significant support throughout his lifetime. But that doesn't mean that his life is a tragedy, like RFK would have you believe, or that he is less valuable or less worthy. Alex is charming and funny and very opinionated. He loves pizza, Disney, the Beatles, the Eagles. He hates the mamas and the papas. He likes going to musicals. Wicked is his favorite, and he likes going to the movies. He loves and is loved. He's a son, a brother, an uncle, a nephew, a cousin, and a friend. So how does Medicaid help him? Medicaid funds Alex's health care and his medications. Alex is also a cancer survivor. Medicaid funded life-saving cancer treatment and his follow-up care. Medicaid, I didn't think I was going to cry. Medicaid, through the Family Care Program, funds the group home that Alex lives in right here in our community. This group home provides around-the-clock awake care, but it also does so much more for him. It goes beyond meeting his basic needs. They provide companionship and support. They help him engage with peers and with his community. He's gained independence and continues to grow. Group homes like Alex's get paid a preset daily amount per resident, and that money is used to pay staff and cover overhead. There's an incredibly high rate of turnover in the field, and it's challenging to find and retain staff. Because of the reimbursement rate, there's no wiggle room to offer more wages. According to the Wisconsin Assisted Living Association, the long-term care system faces stiff competition in its ability to recruit and retain a workforce that may opt to pursue the same or higher pay and other less stressful employment. 139 assisted living facilities closed in 2023 in Wisconsin, with staffing shortages and low Medicaid reimbursement rates cited as reasons contributing to their closure. Alex faced the sudden closing of the previous group home that he lived in. We were given 30 days notice of closure 2 weeks before Christmas in 2022. We had to scramble, and with the help of his case manager and a whole lot of luck, she found a new placement for him. Cutting federal Medicaid funding would put an increased burden on a system already in crisis and could result in even more facilities closing and people becoming displaced. Where are these people going to go? Alex lives in a facility only 2 miles away from his dad and I, which allows him to be cared for and to be independent while making it very easy for us to see him on a regular basis. If facilities close, if his group home closes, will there be enough beds available for people to relocate to? Will there be options in their same community where they can keep their community connections? If Medicaid is cut, Alex and other vulnerable people in need will lose vital services. Assisted living facilities will close. Alex deserves to have a safe, supported life that enables him to be as independent as he can be. Thank you.
Next is Chelsea.
We live in Black Creek. I would like to move back more into Appleton with my partner if we can. But in 2022, I left an abusive marriage, and it was because of Medicaid that I was able to do that in large part. I have several diagnoses, some lifelong chronic illnesses, as well as I'm also autistic, somewhere between a level 2, level 1. They're, figuring that out if you care about that. But I also have fibromyalgia, and I struggle every day to get my personal care tasks done, as well as try and work as much as I can. I currently am working about 20 hours a week, a little more than that, and it takes everything I have to take care of myself and do my job. I'm an educator at the Botanical Gardens in Green Bay, and I absolutely love it, but I also then, that takes up all of the energy that I have in a day. And so when I am trying to go about doing my tasks and all of that, I need a lot of help, I need all of this, and I have been denied disability twice, and I know that's a separate, different thing, and I was like, all right, I'm not disabled enough to get that help, that's fine, I still have Medicaid. I knew at least my basic cares would be taken care of, but I lost Medicaid due to, a clerical error at the end of February, and I have been uninsured for the last 4 months. And I have had to pay for all of my medications out of pocket. I haven't been able to go to any of my follow-up doctor's appointments. I got 2 life-saving iron infusions earlier this year, and I haven't been able to do any of the follow-up from that. If I needed another one, I probably won't be able to get it. So all of this to say is that Medicaid is what's currently keeping me going, but it's also the amount that has changed my life in the last even just 4 months, the amount of stress that it's added. I've gotten tossed back and forth. The problem that they're having is that I make just a right enough amount of money. So it's somewhere between $15,000 and $16,000 a year is about how much I make. And because it fluctuates a little bit, the max that I could make and still be on Medicaid is $16,000. But I am just below that. And so when I go to apply for the marketplace insurance. So I'm going, I don't even need, I'm just trying to get some sort of coverage. And they say, no, you can't get this. You don't make enough money. You should be on Medicaid. And so then I get tossed back there, and then Medicaid says, can you prove to me that you make this money? So I do, I send in all the paperwork, and then they come back to me and say, no, I'm sorry, you make too much money, go get a marketplace plan. So this has now happened to me 3 times over the last 4 months that I've gone back and forth like this. So currently, I now have to prove for a 4th time all my jobs and my income to try and see if this time around they'll tell me I'm eligible again. But it's really disheartening. And every day I wake up going, well, can I, should I take my meds today, or should I wait and ration them a little bit because I'm going to have to pay for them again soon. But I know if I don't take them, my whole life's going to fall apart and I'll lose my job, and there's no options. So when people say that, again, there's fat to cut, or there's waste, or all of these different things, I'm like, how much wasted time did I spend sending back and forth papers over and calling all the people that I've called, all these really wonderful employees that go, I don't know what to tell you, I'm just doing what I'm supposed to be doing. And I say, well, thank you for trying. And that's what I get that day. So I know I'm not the only one. I had a friend of mine who was able to live because of Medicaid. She told me she wasn't going to go to the doctor for prenatal care, and she was going to try and get an abortion, but she was having issues. The Roe versus Wade had been overturned recently, and she was trying to figure all of that out. She didn't even have time to get that information because she got so sick, and it turns out her pregnancy turned ectopic. Pretty much, that's what it is. It was ectopic from the beginning. But she nearly died because she wasn't getting health care fast enough because of all of this. And it was only because of Medicaid that she was able to cover it and move forward. So I guess you'll hear lots and lots of stories, hopefully over the next couple of months, and hopefully you've already been listening. But we're just people trying to live our lives. And most of us, like I said, are working. And I'm working to the detriment of my health, trying to just stay afloat. So, thanks.
Thank you, Tim. So we have